Hello everyone, my name's Kian. Welcome to Everyday Energy, the podcast we talk all about health and wellness with tips and tricks you can use to optimize your mental and physical well-being. And today I'm joined by a very special guest, Thomas. I met Thomas on a flight to Dublin actually. Would you like to introduce yourself, Thomas?
Yeah, hi everybody. Yeah, my name is Thomas Kador. I'm an associate professor in creative health at University College London. And I guess that's what we're here to talk about. We're here to talk about creative health today, right?
Yeah, definitely. And we'll talk about how we met a bit more. So I was sitting on the plane, I was 2 seats away from you, and I saw you reading some paper, and I was like, oh, that looks interesting. And I asked you questions. You're like, yeah, I'm studying a lecturer for creative health. And I was really intrigued. So what is creative health? Can you give a definition for people?
Yeah, I mean the one-liner is it is about utilizing the arts, culture, nature to support the health of the public in the shortest sense. So it's about drawing on non-clinical ways that are very often already out there in the communities to support people's health. So whether that's community centers, local parks, of course, schools have a role to play, and entertainment venues, gyms, theaters, any concert venues, anything that's out there that we could potentially utilize without having to draw on the very stretched clinical resources, the NHS resources that we have. So that's it in a nutshell.
Okay, that is very interesting. So you're saying that rather than focusing on the pharmaceutical side and the clinical side, like hospitals, doctors, GPs, you're looking more for holistic approaches that are, so maybe not just fitness and nutrition, but more creative ways. So things like, would it be music, that sort of thing?
Yeah, it can be music. So absolutely. So it is about, so if you look at something that we in the sector would refer to as the social determinants of health, right? All the different things that come together to make up a person's health. If you look at that holistically, it is only about 20% of our health that is determined by clinical factors, by the medicines we take, by surgical interventions if you need them. So clearly that has a space. You know, if you have a heart attack,
Yeah.
you need medical care and quickly, or if you have a stroke, or if you have a serious illness. So that there's no two ways around that. But for most of our lives, most of the time, we don't need to go and see a doctor. We don't need to go to A&E. We need to try and find ways of keeping ourselves healthy.
Yeah, of course.
And so that's what creative health is really about. It's essentially part of this broader um, picture of preventative health, if you want, of keeping people healthy for longer without them needing to go and seek clinical help or be on medication for a long time.
Yeah, no, that's so true. And of course, yeah, like you said, if you have a heart attack, a green smoothie isn't going to save you. You need
No.
to go. So there is a place for medicine and there is a place for treatments. But with the preventative side, I think that's really important going forward because obviously the NHS is stretched at the moment. It's hard to get doctors for everyone, GP appointments. So if people look after themselves from the beginning, there's going to be less illnesses, less diseases, cancer is going to reduce. I think that is the way forward, preventative health. And creative health, again, I'm still trying to get my head around it because it's very new to me. How long has it been around in universities and studies?
So the definition of creative health is that's quite the terminology that's actually putting creative and health together is quite recent, but we've had it for a few decades a movement, if you want, that's called arts and health, which is a little bit narrower, but that's been going maybe for 15, 20 years already. Whereas creative health, the terminology came about in 2017. Actually, the Parliament in the UK commissioned a report. There's an all-party parliamentary group, so it's not partisan. So there are representatives from all parties on that the small committees, and they hear witnesses. And we've contributed to this. And in 2017, they published this report called Creative Health. And that's really where the language comes from. And on the back of that, so in that report, there were a number of recommendations.
Hmm.
And one of them was that we need more opportunities for education and training in the field. And this is when we set up our program, which is called the Masters in Creative Health at UCL, which started then just after the pandemic, started in 2021. I guess after the height of the pandemic, the COVID was still going at the time. But so it's been around, say, for the last just under a decade or so, as in that form, calling it creative health. And it's catching on now internationally as well, which is interesting. So initially, it was quite niche. I think the people who referred to this as creative health, but now we see it catching on in lots of places, in particular in the UK, but also internationally.
Okay, that's good. And I think there is a need for it as well. So it's really important that what you're doing. So you're a lecturer at UCL currently,
That's
and
correct.
you run the master's program for creative health. Nice. So you lecture and then do your research projects as well alongside?
That's right. Yes. So the masters is very much research focused, actually, and in fact, it's evidence focused, because the most important, one of the most important things we can do in this field is contribute to the evidence base that demonstrates how going to the gym, or how joining a choir or a knitting circle, or a weekly well-being walk in the local park, how that improves people's health, how
Yeah.
that improves their well-being. And if you want to get support for any of those activities from health funders or from social care funders, from the local authorities, from the NHS, you need to be able to demonstrate that the evidence holds up, that this is actually sound and money well spent. And this is really what we are focusing a lot, both with the what we teach our students, and they then do a big research project at the end of their masters, and also the research we do outside of the classroom ourselves as creative health researchers. Is a lot of it is to do with producing the evidence that demonstrates it, and then also translating that evidence so that clinical commissioners, doctors, politicians, policymakers get the message, and investigate the role that these non-clinical activities can play, and also realize the potential already that's locally available in their area. Thinking about, sometimes these things are referred to as community assets.
Yeah.
That sounds like very financial speak, but essentially all these things that I already mentioned, like local playgrounds, parks, play centers, gyms, theaters, concert venues, all churches as well, and mosques and places of worship, all of these local facilities that are already there and that we can draw on, and for their health benefit. And social connection is such an important part of that. If you're lonely, that is probably more dangerous, especially as you get older, than smoking 20 cigarettes a day. It's a
Wow.
real loneliness, social isolation is a real killer. So therefore, even just that social connection that any of these places can bring to people, so they are less lonely, can make a huge difference to both prolonging their life, but also prolonging their life in a positive way. So they don't just live longer, but they also live longer, healthier and happier.
Yeah. So going back to the health span rather than the lifespan, in your
Yeah.
later years, are you living comfortably and can you do the things you can when you're younger? So I work for a Meals on Wheels charity at the moment, full time as a nutrition advisor. And a lot of the adults I see, yes, they're malnourished, but they're very lonely. And you're right,
Mm.
the isolation is the worst part for their mental health, because I go to them, ask them, how's your social life? Some of them say they have no friends. And it's very sad to hear. And there's not a magic pill that can fix that. We need things like befriending services, social circles, so things like the creative health that you're researching is really important. And as a coach, obviously I offer people advice and give guidance about, okay, you need to go for a walk a day, you need to go and eat your greens, you need to do your fitness. But having the evidence there and the data is really what helps, and it gets people in their mind when they see a research paper or they see the data and the evidence, they think, okay, actually, I'm going to do this because they understand the why. So, from your research, what have you seen has been sort of the most beneficial creative health methods for people's health?
So, as we already said, so anything, especially when we talk about older people, anything that reduces social isolation has clear demonstrated benefits. Um, and that extends, it's not just the mental health. I shouldn't say just. Mental health is obviously really important, but it goes much further. And you probably noticed from your charity work that people who are on their own then tend to eat less well
Yeah.
because there's no point cooking for yourself kind of thing, and you don't eat regularly because you don't make the occasion that you would have, and you have meal times with your friends or family. They tend to be less active, they tend to move less, so therefore that then brings lots of issues again, especially with people as they are getting older, that they are less secure on their legs.
Mhm.
They are more likely to have a fall, therefore, and also they are less active, therefore are more likely to become overweight, both with the poor diet and less active, so more likely to end up having type 2 diabetes, and which is obviously a huge risk factor then for heart disease, stroke, lots of other things. So there's a whole gamut of things that are related to social isolation. So anything that reduces social isolation, and there's lots of evidence for that, is a positive thing. And it's different strokes for different folks. It's about finding the thing that the person is most interested in, that works best for them, that is least, I guess, different from what they already would like to do. So if they are interested in working with their hands, in doing crafts, in knitting or crochet, then finding a local circle where they can meet with people, and do that, then that's the great start. If they in their younger days used to be into ballroom dancing, then find a dance group. If they
Yeah.
like music, find a choir or something like that. So there are lots of options. The main thing is to get people out of the house and get them to socialize in that setting. So that's definitely one body of evidence, where there is lots of research from all sorts of contexts, very locally in the UK and internationally, that reducing loneliness, in particular in old age, is really striking. And there's also another aspect that I should mention in that context, and that's a relatively new phenomenon, but your listeners might have heard about it, is something called social prescribing.
Mhm.
That so if people go to their GP, instead of getting a prescription of anti-anxiety medication, for example, or sleeping tablets, the GP can refer them to somebody called a link worker, sometimes community connector, so another person who has slightly more time to spend with the patient, if you call him that, than the GP, which usually a general practitioner has 10-12 minutes for you, whereas
Yeah.
the link worker has a little bit more time, the social prescriber, and they will get to understand what makes you tick, and
Mhm.
then find something to refer you to. So instead of being on 10 weeks of Anxicam or some anti-anxiety medication or medication for mild depression, they might refer you then to a local walking club in a park, or a drama group, or a
Yeah.
choir, or something like that, something that you might find interesting. And this has shown also there's some great pilot work from social prescribing, and England is leading the way. The NHS is leading the way internationally with social prescribing.
Wow.
So there's some great pilot work and how that actually makes a real impact on people's lives. And also, I'm not a great fan of the economic argument, but it is something that's important for people saving money for the NHS as well. And it's very clearly shown that it's much cheaper, um, and much more cost effective to get
And
people involved in local activities rather than prescribing them medication and have that revolving door where they
yeah.
keep coming back to the GP for more.
Yeah, yeah, you're right. And not only is it cheaper, but long term, it's more effective because they're less likely to come back to the GP once they've got that problem solved. And you're right about the happiness side of things. When you're happier, you do make better decisions, whether that's your nutrition, your fitness, your lifestyle. So, and I like the term you used. It's a different stroke for different folk. So, especially when people try and think of new hobbies to do, a lot of things people try maybe yoga or they try going to the gym and it's not for them. So it's right to find the thing that works for you. And that could be
Yeah.
anything. You said like knitting club. It sounds ridiculous, but if you like knitting and you like relaxing, it's not a bad idea. Playing chess, go swimming, even just going for a brisk walk. So you don't have to go for a run. You can just go for a walk, pretend you're kind of in a rush to somewhere and walk in a pace that you're still testing yourself and increasing your heart rate. So I really like that. And you're right, social loneliness is huge. And I think there is a lot of work being done. And I like how England are number one in the social prescribing. Is it research? Yeah, that's really good. And
Yeah,
yeah, sorry, go on.
research is also as a delivery already. Yeah.
Okay, that's
Sorry.
amazing. And other than the social and the loneliness, what other sort of creative health methods are there that maybe the listeners can use or people are unaware of that are really beneficial?
So yes, and the focus has been a little bit so far on maybe on older people, which is obviously an important element, and we are an aging society, but creative health isn't just for older people, and it's also important to say that actually young adults, late teenagers, and people in their early 20s are, after older people, the second most likely group to be socially isolated and lonely. So that's
Right.
really important that young people, very many young people also face, and especially coming out of the pandemic, young people face loneliness, even though they go to school or something, but when they're on their own, they're on their own. Their
Hmm.
social life can be quite isolated. So that's important to say. But so social prescribing, creative health, they are not just for older people. Is the, I guess, the important message. And one really striking study that came out of some of my colleagues from King's College have been involved with this, with a charity called Breathe Arts and Health, which are looking at singing groups, choirs, other singing groups. Initially, they started looking at lung health, but also more broadly for breathing health.
Hmm.
And they have conducted a clinical trial a couple of years ago. It's a full randomized control trial, almost like when you test a new tablet, a new vaccine. So
Yeah.
really highly structured clinical trial of singing groups for women with postnatal depression. So
Okay.
all young mothers, participants were all young mothers all over the country who experienced postnatal depression, which is obviously a big issue for young mothers, especially on their first child, but not only. And
Hmm.
what they found is that there was significant reductions, really significant reductions in the need of depression, in the need for prescribing any medication. Depression, anxiety went right down because these women had this connection to go to weekly singing groups, but also the singing itself seems to have done something, seems to have given them tools that they could apply also when they were not in the group. And that's
Wow.
also the important thing, right? If you're doing something like this, if you're engaging in an activity and you start thinking about it as well, whether it's singing or knitting or forest bathing, it gives you tools that you can also apply when you're not in that situation, when you're not in that social setting with other people singing. You still learn the breathing techniques that calm you down, right? That you can start controlling your own stress response a little bit.
Wow.
And that's really important. So these elements are actually engaging with our bodies a little bit more, and the connection between our minds and bodies, and almost any of those activities can help with that, as long as you make it explicit and give people then tools to apply this in their own time as well as when they're in the group setting. So that randomized control trial is really striking because it so clearly demonstrates that the health benefits to a very much younger population of young mothers.
Wow, that's incredible. That's really interesting. And yeah, a lot of drugs go through clinical trials and pharmaceutical products. So it's really nice to see a social element like choir singing or singing go through the proper trial. And Were the results for everyone? Did everyone see benefits from the singing in the group?
More or less everyone. There was definitely a statistically significant
Yeah.
shift in the positive direction, you know. And as with anything, there might be one, two cases of people who don't see the same improvement as, but overall there was a really strong and significant improvement. So
Hmm.
essentially, yes,
Yeah.
everybody saw a change
Yeah.
in the right direction, a positive change, and
Yeah.
that's striking. But as we said already, it's likely that this is a little bit self-selecting to some degree, that singing might not be for everybody. And I'm
Hmm.
sure there are young mothers out there who don't want to go singing, who would feel really awkward and uncomfortable about it. And then
Yeah.
maybe it's not for them. Then maybe we need to find another group that's more in line with what their interests are.
Yeah.
But it also, I think that was a clear side benefit of this study, and we see that in other work like that, that sometimes putting yourself out there a little bit helps overcome some of the social anxiety that many people are
Yeah.
facing.
Exactly.
And that in itself has a benefit.
Yeah, I was about to go into that. So you might not be able to physically test for any benefits that they got, but internally they might have grown so much more than you could ever know. And that confidence, and a lot of it does stem from confidence. So anxiety, a lot of people are scared to go out and do activities because of that confidence level. So I know a lot of people who would love to do activities and sports and that, but they haven't got that confidence level. And I think by introducing more groups, so I know there's the park runs that are being introduced now across like countrywide every Saturdays, and they're really, really good. I know a lot of people that do that, and they've benefited so much from them. So I think as a nation, we need to push for more of those community-based activities, and I think there's a lot of room for it because there's a lot of green space, there's a lot of funding that can be put into it. So it's now about finding the path to implement them. How do you see creative health in the next like 5 years? Do you see it really boosting and booming?
I, at the moment, it looks like it is on a growth trajectory. I think more and more people are waking up to the benefits, and none of this, you know, you asked me this at the start, how new is it, right? None of this is really new per se, right? People have been connecting socially since humans first evolved, right? Social connection is one of the most important things for us as humans, as people. People have been engaging in physical activity. People have been, you know, thinking about and working on eating healthily and diet and nutrition for forever, depending on obviously what food is available and culturally acceptable. So all of these things, none of these things are actually new in their own right, but looking at them through this lens of how they can support the health and well-being of the whole population is the new thing, right?
Yeah.
It's just a slight shift in how we think about it, and how we can therefore discuss these things. And I think that's the new thing. And yes, I think there's a growing realization that this can really make a difference to large amounts of people, and therefore be not only cost effective but also time and effective in lots of other ways, that simply the health service is just not set up to do this. The you know, the NHS was set up to help people when they were ill, and that's still sort of what it does best, right? If you need to go to hospital and you need treatment, then that's what you get. But it's not set up for keeping the population healthy. It just can't do that, right? It can help them when they're in crisis, but most of us, most of the time, hopefully, we're not in perpetual crisis, but we still need help with staying fit, staying healthy.
Yeah.
And that's really what creative health is all about. And yes, I see that developing and growing over the coming years and hopefully decades. And as I said, more countries are getting on board with this as well and realizing the benefits. And it's, as I said, for most of us, it's not a new thing. It's just a shift in language to rethink how we talk about health.
Yeah. Yeah, I like that. And with the social loneliness, and you said it's been around for ages, people being in groups and talking and getting together. One thing that I think that's really negatively impacted that is our phones and the rates of anxiety and depression, I think, are massively linked to the amount of time we're spending on our phones. Because a lot of even teenagers nowadays, they're in their rooms scrolling on TikTok, Instagram, like, and they're just scrolling, trying to chase that dopamine. And unfortunately, that's draining their dopamine. So then when they do things in real life, like football, tennis, like it doesn't hit the same. That level of happiness doesn't quite there. And I think the only way we can change that is individually we make a more of a conscious effort to reduce our screen time, whether that's getting apps that you block for, like, you do 15 minutes a day, or you make a rule, okay, I'm not going to consume this content, I'm going to start creating content. So you don't watch Instagram videos, you make Instagram videos. And you have to kind of be responsible for your own happiness. You can't expect the doctors or like people to come in. You have to work on yourself, and it's difficult for people. So that's why I think the groups, like you said, being introduced over time is going to help a lot of people. And it's hard. It is hard because the phones are addictive. Even I'm finding myself. So I've made a rule, like, okay, I'm not going to go on my phone till 11 o'clock in the morning. I'm not going to go past 10 o'clock at night. You have to set your own, like, your boundaries. You have to be your own adult, and it is difficult. I wanted to ask you, how has, since you've been doing the creative health stuff, how has it impacted your life? So what have you implemented from it?
It's funny you say that, because I think it's mainly about being conscious of it. I mean, I've probably been, living a relatively healthy life. I've never been a smoker, never been a big drinker. Always liked being physically active. So I don't think I've made any major shifts, but being conscious of the things that work is
Mm-hmm.
really useful. And there is this podcast series. It's not quite competition, but I don't know if you've come across the late Michael Mosley, who sadly died a couple of years ago, on BBC, who had this series called Just One Thing, and where he goes through different things that you might do, just small shifts in your everyday life
Mm-hmm.
to improve your health and well-being. And it's about those small shifts, right? It's making a small shift, but something that you can do persistently, right? Something that you can do ideally on a daily basis, right? So like, for example, uh, going being active first thing in the morning, or going for an early morning walk if you can, or run, or whatever your fitness allows, is a really good thing. So I try and, within the first couple of hours of getting up, I try and do something active before I start working,
Yeah.
usually before I have my breakfast. So those kind of things, and the way I think about it, and also the stepping back, which links a little bit to the screen use as well, I think. But if you realize you're in a stressful situation, right? If you realize your heart rate is going up, you're becoming nervous, you're becoming upset, is, can you remove yourself from that immediate stressful situation? Can you talk yourself down in a way? Can you if you just realize, okay, this is stressful, it's difficult, but am I likely to get seriously injured, or something in this situation? Is it physically gonna harm me, right? Or can I actually take 30 seconds or a minute to just regulate my breath and return, my heartbeat to a normal level? And so being aware of what we can do for ourselves in terms of regulating our stress response is also really useful as a skill. So some basic, it's not even meditation, but some basic kind of meditation type skills, just recognizing the importance of breath, is something that I hadn't really thought about very much before, despite being, eating relatively healthily and being physically active. Um, that element of how we can actually physically improve our response to stressful situations, and I find that is really a really useful skill, and something that everybody can do quite easily. But it's really takes some work, and we've had a student, for example, who did a research project on, because of her own experience, on using very simple breathing techniques to as a means of reducing the need for painkillers.
Wow.
And in her case, her experience was to do with childbirth, and she had a really difficult labor on her first child.
Yeah.
But she actually realized that she could regulate her stress response, and that allowed her to go through the labor without. She was on the verge of needing cesarean section, but she managed to regulate her own response to the extent where she didn't need more painkillers, where she didn't need cesarean, and she could go through the whole labor
Wow.
and that was transformative. So that's really striking. Those stories, they
Yeah.
are a little bit anecdotal, but that leads to research. So this
Yeah.
student now has gone on to become a researcher in this field
That's
and
incredible.
trying to demonstrate the difference it can make just to take a few minutes and breathe carefully and
Yeah.
properly, and the difference that can make. So that's really striking.
Yeah, 100%. And that's been the biggest part of my growth, just the conscious breathing. Like, you don't have to go and sit in a park and meditate for 20 minutes. You can literally stand. So when I was walking this morning, I went to the park, saw the sunrise because it's good for your circadian rhythm and your sleep cycles. And I looked in the sky and I just took like 5 conscious deep breaths through your nose and then out your mouth. And that's all it is. And then you kind of feel alive, and it's amazing. And with the breathing, when you said it helped her with the pain, it's true, because when you breathe and take a deep breath, your muscles relax, your nervous system's regulated, your flight and fight response is dampened, and you're not in a heightened state. So the breathing is such a simple tool you can use anywhere in your life. So a lot of people, like when you're going on the train to work, you don't have to maybe go on your phone. You can just take some deep breaths, and it sounds ridiculous, but it does help so much. And with the
Yeah.
conscious, with the healthy things we do in our lives, and when we do, say we go for a walk or say we go for a run, mentally, internally, remember how you feel after that. So be conscious of how good you're feeling, and then that feeling, next time you think, oh, can I be bothered to do it, remember that feeling of how great it feels, and then you will just automatically be like, okay, yeah, you know what? I'm going to go and I'm going to go and do this thing because it makes me feel good. And then that compounds over time. You do 5 of those things a day, you feel amazing every day. It's not difficult stuff, but it's about having that discipline and, yeah, staying conscious and aware of the things you're doing.
Absolutely. And the other thing actually that sort of links with that, when you mentioned the sunrise, that made me think of it, is paying attention, is noticing things, right?
Mm.
And that also relates a little bit to the screen time. That noticing things that are not on your screen, looking up from the screen and noticing things around you, like the sunrise. And I find very few things that are more enjoyable than the early morning sun in my face. It's just a wonderful feeling. Or noticing nature, noticing this morning when I was out, I realized, that I hadn't listened to birdsong, although I'm out most morning. But it just usually I just ignore it. But this morning I just focused on the birdsong. Again around dawn chorus, sunrise time, and just noticing things can also make a real difference, because it anything that allows you to take the pace out of a hectic life and
Mhm.
allows you to focus. That helps with the breathing, but so that's really helpful. And I think there's one more thing I wanted to say about the screen time, because I agree that there's a personal thing, but I also think there are things as a society that we can do and need to do to help young people in particular with problematic screen use, right? So I think it's a multi-pronged approach, and there
Mhm.
are actually some apps, interestingly, that are being developed for the purpose of getting people off their screens. It seems counterintuitive, but there are apps, right, that make you, you know, so you can, for example, collect points by being physically active, where you can't look at your screen. So therefore, you use the phone to an extent, but then you need to put it in your pocket in order to do the activity,
Yeah.
and then you can go back and get your reward for it, and so on. So there are different approaches to try and reduce screen use in proactive ways.
Yeah,
So I think there are things we can do beyond saying it's everybody's individual responsibility, because I think that will get us so far. But
you're
I
right.
think there needs to be more help for people as well
Yeah,
to
you're
be
right.
able to get off their phones.
Yeah, that's funny. An app developed for your phone to get off your phone, but it also stems from the parents as well. So if a child see their parent always on their phone, they're going to think, oh, okay, yeah, maybe this is okay. So I'm not blaming parents, but I'm saying we also need to figure out what we're doing and see that our children are looking at us to see what we're doing as role models. But yeah, no,
Absolutely.
it's been a great
Yeah.
conversation. It's been really interesting. I've learned a lot because, again, I hadn't heard of creative health. I know it's basic things to do, go singing, go for a run, but as a study and like a course, I've never knew it was around. So I'm very glad, because when we were on the plane, I was thinking, oh, he looks busy. Should I talk to him? Should I not? I'm so glad I did talk to you because I've learned a lot. And yeah, it's really nice meeting you. Did you
Same here.
enjoy?
Thank you so much for the opportunity. And yeah, if
No, it was
very happy if you have any more questions, anything else about creative health. I think it's important that people realize this is there, and if anybody's listening and they feel, actually, can I ask my GP about social prescribing? If they hadn't heard about it, do ask your GP about social prescribing. Every general practice in the UK should, or in England at least, should be able to refer people now in a social prescribing way. Do so for listeners, they should be proactive if they can, and ask their GP about it if they think it's relevant to them. I think that would be a really great takeaway message.
Thank you. That's amazing. I was going to ask you what your takeaway is. So yeah, anyone listening, if you're going to go to the GP for anything, and it doesn't have to be mentally, or it could be physical health as well, social prescribing is an option. And I didn't know you could even ask for that, so that's really good to know. And it's a tool that you can use for preventative health rather than kind of putting a band-aid or a plaster on something that will cause problems in the future. So I did have one last question, Thomas.
Yeah, go on.
One piece of advice that you would give to your 5-year-old self going back?
To my 5-year-old self. Wow, that's a long time back. I think one of the things that comes with experience, right, is that things are rarely as bad as they seem. And when we are young, I'm not sure about the 5-year-old self, but going into the preteens, definitely, I think young people have a lot of different anxieties, a lot of different worries and fears. So I think my advice would be not to worry too much, to just enjoy the things that are enjoyable around there. You know, the noticing of things that are beautiful and that are fun, and not to worry too much about these little things that can really ruin our day.
Yeah,
And I don't know. I think most young people recognize
yeah,
that if you look back at things, we've all had these things where we lost maybe a few nights sleep and had really horrible days about something that turned out to be a non-issue afterwards. But it's the benefit of hindsight. But having had that for many years, I think that would be my main advice, is to stop worrying, and focus on the positive a bit more.
yeah. I love that, and that comes with growing up and maturing. But you're right. If you could know that when you're younger, that not to get bogged down by the little things, the positives outweigh the little things much more. That's really important and helpful for people. But yeah, I've had a lovely time chatting with you, Thomas, and thank you very much for coming on. And yeah, I'd love to do another episode at some point, but I'm sure there's lots more we can talk about.
Great. Yeah. Happy to. Yeah. If there's anything more specific about any particular area of health or well-being that links to creative health, I'd be very happy to come back. Thank you so
Perfect.
much. Thanks for the
No
chance
worries.
to
Bye bye.
chat. It's always nice to talk.
Bye.
All right. Bye. Thanks, Kian.